Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Dr. Jennifer Koontz of Newton about concussions. Thanks for being here today, Dr. Koontz.
Thanks for having me.
What is a concussion?
A concussion is a traumatic brain injury that can result from a direct or indirect blow to your head or neck. It changes the way your brain functions. We call it more of a functional injury than a structural one because you can't see damage on a normal CT or MRI scan.
What are some of the signs and symptoms?
There can be a variety of signs or symptoms you can see. You can have 1 or 20 signs or symptoms. Some of the common ones include headache, confusion, or personality changes. You can have loss of consciousness, but you don't have to in order to be diagnosed with one.
How is it usually treated initially?
The first important step in treatment is rest. You want to immediately pull the athlete from a practice or game. In the state of Kansas, there's a law that an MD or DO has to provide a written clearance for an athlete to return to their sport. So it's important to see a physician soon.
And what happens next?
Well, 80 to 90% of concussions resolve their symptoms in 7 to 10 days. So usually we focus on rest, and that's adequate. We avoid physical activity and other things that stimulate our mind. That can be computer screens, television screens, or even school. Sometimes students have to miss classwork, homework, or tests, and sometimes they have to modify their school schedule.
When can they usually go back to playing their sport?
Well, you can start to go back after all of your symptoms are gone. We recommend a 5-day progression back to their sport. You can go to kansasconcussion.org for more information on concussions in Kansas.
Great information. Thanks for being here.
Yeah, thank you.
Please join us next week for a new health topic discussion on House Calls.